Antonius Buescher and Mike Gibson coming to you live from ACC 2025, and we're talking about the use of machine learning and AI to analyze EKGs in the emergency department to guide revascularization. Antonio, talk to us about what you did and what you found.
Yes, thank you, Michael, for having me today. Our study was inspired by a daily challenge we face in the emergency department, which is deciding who should be sent to the cath lab when the patient's symptoms are consistent with acute coronary syndrome, but their surface ECG doesn't show any significant ST elevation. In these cases, we usually rely on biomarker changes, but as you know, high sensitivity troponin assays can take time and they can come back positive for many reasons other than type 1 myocardial infarction, like renal dysfunction, tachycardia, respiratory failure, or heart failure. And this adds a lot of complexity and diagnostic uncertainty in the emergency department. And our question was, can we use deep learning to analyze a patient's ECG and determine who's likely to require coronary revascularization and who's not? And we trained and tested the model on 180,000 emergency department ECGs from the MIMIC-4 data set from Beth Israel Deaconess Medical Center. And the model was trained and evaluated on whether a patient underwent a revascularization procedure with PCI or CABG during the index emission. We found that the model performance was very high, with an area under the receiver operating characteristic curve of 0.91, which clearly outperformed clinician ECG interpretation and conventional cardiac troponin T values at admission, which had areas around the curve of around 0.65 and 7.1. We also performed external validation in an independent cohort from Germany with about 19,000 patients. And here the model performance dropped to an area under the curve of 0.81. But this performance loss is normal and expected when applying a machine learning model to a population that's distinctly different from the training population, and especially when the ECG data comes from different machines and vendors. And of course, the decision to perform revascularization can be biased, as it also reflects both patient and operator preferences. So we also analyzed the model's ability to detect type 1 MI in the external validation cohort. And here the model performance was much better with an area under the curve of 0.85. This again outperformed clinicians in both endpoints, and it nearly matched the diagnostic accuracy of high sensitivity troponin T, which had an area under the curve of 0.87 for type 1 myocardial infarction detection at admission. So this was really encouraging and suggested that the model had truly learned to recognize ECG features indicative of myocardial ischemia. And in fact, our explainability analysis confirmed that the model relied on ST segment and T-wave alterations. So in a way, it relearned the ECG features we already know are associated with ischemia, but the model was able to better quantify those features and correlate them with outcomes.
It's a little bit like the Mayo Group showing they can tell you whether someone's a male or female, or if they had recent AF based on the EKG, and there's no way a human could do that. So what's the next step? I mean, is this ready for prime time? Should we be integrating this into daily practice, or does it require further study?
Well, the definite clinical utility will have to be established in a prospective trial. So we don't know if the time to diagnosis is really faster when using the model, and if the acceleration of the diagnostic process will be enough to enhance patient outcomes in the end. So this requires further study, of course.
And this is 12-lead EKGs. I think there's a lot of emphasis now on home EKGs. That would be a single lead, but could assess paramedics in the field when they're seeing a patient in the home, correct? If paramedics get a 12-lead in the home, and I'm doing a trial where they're doing that, this could assist them in the diagnosis.
Yes, of course it could. We don't have data from paramedic machines. These are all ED machines, but theoretically, this would be possible, yes.
Great. Well, congratulations. Great work. Thanks for sharing with us. And thanks to all of you for joining us here live from ACC 2025.